time, I'm going to focus on my main goals in this presentation, which are to basically tell you what is precision FDA, and then also announce our latest challenge, which is very exciting, and I hope you all jump up and participate. So first of all, I'm talking about collaborative informatics community to explore regulatory science, and you're probably all thinking, what's regulatory science? And really what regulatory science is, because the two may not seem to fit together, but really they do, because what we try to do is explore new approaches, new standards, new ways of determining, assessing the safety, efficacy, quality, and performance of regulated products. So you may have heard, I hope you've heard, about the White House Precision Medicine Initiative. President Obama announced at his State of the Union in January of 2015 that he was starting this new initiative. And what's exciting about that initiative is that you're garnering all these government resources towards precision medicine, looking at ways of really understanding what it takes to, as we say, finding the right treatment for the right person at the right time. So precision medicine and genomic tests. What we're talking about here is when you have next generation sequencing, being able to identify at this vast amount of information for an individual person, whereas before, you would say, what's precision medicine? Doctors have been doing precision medicine for years. I meet with a physician, I meet with him regularly, he knows my background, he knows what illnesses I've had, he knows a lot about me. But this is something much more. This is a huge amount of information based on the sequencing of your DNA. And putting that into the hands of the physician can be very powerful. However, the approach we would normally take with regard to medicine doesn't really work for approving drugs, things like that, approving products. Doesn't really work for rare disease, because we use very powerful tools called clinical studies. But as you heard in the previous presentation, that can be a little difficult when it's a rare disease. This picture right here is of the very first patient, Nicholas Volker, who actually was the first person whose DNA was sequenced and he was effectively treated based on finding a problem with his DNA, a variant. So what happens here is you keep getting data from your clinical environment and going back to the research. And that's what a lot of what we talked about in the previous presentations was we keep going back to the research. And the research feeds information into the clinical feeds information back into the research. So that iterative approach is a little different than the way that we have historically done that. And that affects how we as regulators determine safety and efficacy. So FDA's role in PMI, as I said before, we're responsible for ensuring the accuracy of genetic tests, but we're also responsible for doing that without slowing down innovation. And the next generation sequencing and the understanding of the variants, it's all right now in a very iterative phase. We're still learning a lot. The science is evolving. There's still many things that we don't know. And FDA doesn't want to get in the way of that. We have to adjust the way we do regulation. So here comes Precision FDA. This is the first system that was really approved, really implemented as part of the Precision Medicine Initiative. And really what it is, it's a community platform where we can bring researchers and developers together to really evaluate and look at next generation sequencing, better understand the tools, the applications, and help FDA to better understand new ways of regulating this area. When you first log into Precision FDA, this is what you're going to see. You're going to see you could create a note, you can upload a file, you could run a comparison, you can launch an application. By an application, I may mean a component of a pipeline, the analytical pipeline that takes the sequence data and analyzes that data to tell you where the variants are, where problems might exist. And you can add an asset, you can add a component, you can create your own app. There's many things that you can do on Precision FDA. It's very much geared towards bioinformaticians, but we are open and interested into how this collaboration platform may engage physicians, might engage patients. We're very interested in seeing where this can go. So our portal is open source. It is available on GitHub. You can find it there. It is built on a mature platform to ensure that we have the security and the standards that we need. And that platform is the DNA Nexus platform at the moment that we're leveraging. And on Precision FDA, we have both public and private space. One of the carrots we offer developers to participate on Precision FDA is we said, go ahead and use the private space. Nobody's looking. And we can't. In order to maintain our security posture, we cannot see anything that's going on in the private space. What's nice for labs, for students, is now you have this computational, very powerful computational platform. You have pipelines, you have all these resources at your fingertips to be able to do these analytics that maybe you don't currently have the capability to do today. So one of the ways we've been trying to engage the community is through challenges. Our first challenge was the consistency challenge. And in this challenge, it was sort of an easy challenge in that the answer to the test was given. But the idea was really let's test out the platform, let's see how things work. So what we did on this challenge was we started in February, we ended in April, and during that time we had a number of people who participated. We took data sets, the same set of information, data from 2 different labs, Garvin and HLI, and we asked them to run the comparisons and benchmark those comparisons against a well-known data set, the NIST NA12878. The next challenge was the Precision Truth Challenge. Now this was really exciting for us because this was the follow-on to the first challenge. And what we really did here was we opened it right away and we said, okay, Genome in a Bottle has the data set they haven't released yet. And they said, okay, we're not going to release this reference data set. What we're going to do is we're going to let you run this challenge and then we'll release it afterwards. So you couldn't really tune your systems, your analytical pipeline to the answer. You didn't know what the answer was. So it was a bit risky for our community. They had to have this opportunity to really try out something and see where the chips fall where they may. So we had actually about 36 people participate, a large group of people. This is a sampling of those that participated. And so we realized this challenge is, you know, people like to compete against each other. So we want people to share data, we want people to share information. So let's see what we can do. So we came up with this new idea, and it's very exciting because it's a toolbox which we've created so that you can run your own App-a-thon. And what I mean by an App-a-thon is that you can get a group of developers together and you can either build an app or you can take an app and maybe it's already built, maybe it's something you've been using, but it's not on Precision FDA today. We want more applications, we want more information now in the public space. The more the better, because the more that we have, the more people are engaged in advancing the science. So this toolbox tells you, it provides for you things like videos, how-tos, it lets you create a banner, it lets you talk to a group of people. You can set up some of your friends and say, hey, let's get together. We're going to do this App-a-thon. You might do it in a day. You might do it in a week. You might do it in a month. We're asking that people complete their App-a-thons by the end of October. And just so you know, you don't have to be a bioinformatician in order to run an App-a-thon. But you might want to have some in the room when you're running the App-a-thon. But that would be helpful. And I want to just show you, we had Stanford do an initial App-a-thon, and I want to show you that App-a-thon. I have a little video, which I think you'll be interested in, so you can see how that App-a-thon went.
Hi, I'm Shannon Young. I'm from Center for Devices and Technology at FDA. I'm very happy to be here to be part of the first App-a-thon event.
I'm here today kind of as a host of the first App-a-thon, which is happening over my shoulder, where there's 4 or 5 apps that we're trying to wrap and make available in the Precision FDA platform.
I have a lot of friends who are interested in genomics and next-generation sequencing and regulatory science, and so we thought it would be really great to all get together and contribute to this community. currently trying to upload the program RTM onto the FDA. So my teammates and I are working on uploading RTG. I really like the FDA website for the FDA. I find that it's easy just to create the initial app architecture and structure.
When I saw this Precision FDA platform, I thought it might be a good way to distribute this program we've made and make it easier for people to use.
What we're hoping to achieve today is an increase in the number of applications that are available so that non-specialists can, in a drag and drop, fill in the box type interface, start using these codes. And that could really be a turning point where we democratize the analysis of next-gen sequencing data and make it available to a much larger set of scientists.
App-a-thon is really fun because we're working with a bunch of other developers, and we're all have the same goal in mind. I think the App-a-thon went really well. We have these 3 programs that are installed and available for use.
Like, let's just get Precision FDA to have a critical mass of apps that will then start flowering lots of different uses.
So that's the end of my presentation. I hope you will take the challenge and initiate an App-a-thon and help to expand the community that's participating and the number of apps that we have on Precision FDA. Any questions? Actually, it's already started. We have the Stanford App-a-thon, but you can participate in this App-a-thon period until the end of October. And we will likely, after we evaluate the results, we will be having other App-a-thon periods where you can have App-a-thons. But during this period, we have actually something very exciting, so I'm really glad you brought that up. In November at the World Precision Congress in DC, the commissioner of the FDA will be talking about the App-a-thons that took place and some of the lessons learned and some of the things that happened, and he'll be highlighting that in his presentation. So this is your opportunity to be part of that. So I hope you'll take that opportunity. Actually, no, it's wide open. If you would, anyone can host an App-a-thon. I would encourage you to, if you know people who are developers, we're trying to really expand the number of people in this field because that's how innovation happens. And I know you're not used to hearing regulation and innovation, but here we go, we're trying. So I hope you will get the word out, help us get the word out. We currently have about 1,800 community members, and we'd like to see the kind of community members that you have in your site. So. Yeah. Thank you.